Linda is 58 years old. She lives alone in a small apartment in North Carolina. She retired early 3 years ago because her knees couldn't handle the warehouse job anymore. She gets by on a tight budget. SNAP helps her buy groceries. Medicaid covers her blood pressure medication and her diabetes supplies. Last month, Linda opened a letter from her state benefits office. It said she had to prove she was working 80 hours a month or she would lose her food assistance. Linda stared at that letter and she thought, there has to be a mistake. I'm 58. I thought people my age were exempt. She wasn't wrong to think that. Until recently, she would have been. But the rules have changed, and millions of Americans between the ages of 55 and 64 are about to face the same shock Linda did. I am Jocelyn, and on this channel, I break down the rules that affect your retirement, your benefits, and your financial security in plain, simple English. No legal jargon, no confusion, just the facts you need to protect yourself. Today, I am going to walk you through one of the biggest changes to hit older Americans in years. It affects your food assistance. It affects your health insurance. And if you're between 55 and 64, it could affect you right now, not next year, right now. I'm going to explain exactly what the new law says. I'm going to show you who is exempt. And I'm going to give you 3 specific steps you can take today to make sure you don't lose your benefits. But please stay until the end, because there is one hidden mistake that most people in this age group are making. And it's the #1 reason people are losing coverage even when they actually qualify to keep it. I'll explain exactly what that mistake is. Let's start with a story that shows how fast this can go wrong. Robert is 61 years old. He lives in Ohio. He worked in construction for 35 years. His body gave out before his retirement age did. Bad back, bad shoulder, constant pain. Robert retired at 59. He wasn't old enough for Medicare. He didn't have a pension, but he qualified for Medicaid because his income was low enough under the expanded program in his state, and he got SNAP benefits, about $212 a month, to help cover groceries. Robert knew the new work requirement law had passed. He saw it on the news, but he thought to himself, I have a bad back. I can barely move some mornings. Surely I'm exempt. And here's the thing. Robert probably was exempt. His physical condition likely qualified him for a disability exemption under the new rules. But Robert made one critical mistake. He assumed the exemption was automatic. He didn't file any paperwork. He didn't submit any documentation. He didn't call his state SNAP office. He didn't get a letter from his doctor. 3 months later, Robert's SNAP benefits were cut off. Then, when his Medicaid renewal came up, the state couldn't verify that he met the work requirement or had an exemption. He got a notice of non-compliance. He had 30 days to respond. Robert didn't understand the notice. He thought it was just another piece of government mail. He set it aside. 31 days later, Robert lost his Medicaid, his blood pressure medication, his pain management, gone. Without Medicaid, Robert had no affordable path to health insurance. His income was too low to comfortably afford marketplace premiums without help, and navigating a new enrollment while sick and confused is exactly the situation these programs were designed to prevent. Robert fell through every safety net at once, not because he didn't deserve help, but because he didn't know he had to prove it. This is happening to people all across the country right now, and I don't want it to happen to you. Let me break down exactly what this law says. Part 1, the SNAP work requirement expansion. On July 4th, 2025, President Trump signed the One Big Beautiful Bill Act into law. Among many other things, this law expanded the work requirements for SNAP, the Supplemental Nutrition Assistance Program, what most people still call food stamps. Now, SNAP has had work requirements for years. They applied to what the government calls ABODs, able-bodied adults without dependents. Before this law, those requirements applied to adults aged 18 through 54. Here's what changed. The new law raised that upper age limit from 54 to 64. That means if you are between 55 and 64 years old, you are now subject to the SNAP work requirement for the first time in the history of this program. These new requirements are already active, and if you are newly subject to them, you must demonstrate compliance by March 1st, 2026. The first month when benefits could actually be cut for noncompliance is June 2026. So if you are in this age group, you still have a window to act, but that window is closing fast. So what exactly do you have to do? According to the USDA, to keep your SNAP benefits beyond 3 months in any 3-year period, you must do one of the following. Work at least 80 hours per month. That can be paid work, unpaid work, or volunteer work, or participate in a qualifying work or training program for 80 hours per month, or do a combination of work and training that totals 80 hours. If you don't meet that requirement and you don't have an approved exemption, your SNAP benefits stop after 3 months. And to get them back, you have to work or participate in a qualifying program for a full 30-day period, or you have to wait until the end of your 3-year cycle for another 3 months of eligibility. Now, there are a few more changes you need to know about. The definition of dependent changed too. It used to be that having a child under 18 in your household exempted you. Now, your child has to be under 14. So if you're 57 and your youngest child is 15, you are no longer exempt under the dependent rule. And one more thing, veterans and people experiencing homelessness used to have automatic exemptions from these SNAP work rules. Those automatic exemptions have been eliminated. If you're a veteran or if you're unhoused, you now have to meet the 80-hour requirement or qualify under a different exemption like disability. Part 2. Medicaid work requirements. The same law created mandatory Medicaid work requirements for adults aged 19 through 64 who are enrolled through the ACA Medicaid expansion. This is the first time in American history that federal law has required people to work in order to keep their Medicaid health coverage. The requirement is the same number, 80 hours per month. That can be employment, community service, job training, or vocational education. Most states have until January 1st, 2027 to implement this, but some states are moving faster. Nebraska, for example, has announced it will begin enforcing Medicaid work requirements on May 1st, 2026, just days from now. This applies in 41 states plus Washington, D.C. If your state expanded Medicaid under the Affordable Care Act, these rules are coming to you. Here's the number that should concern everyone. The Congressional Budget Office estimates that by 2034, 5.2 million adults will lose Medicaid because of these work requirements. 4.8 million of them will become completely uninsured. And according to the CBO, very few of those people will have access to employer-based insurance. And the situation is made worse by this reality. When you lose Medicaid, finding affordable replacement coverage is genuinely hard. If your income is low, marketplace premiums, even with subsidies, can be a significant burden. And if you're between 60 and 65, you are still years away from Medicare. There is no easy backup plan. Part 3. Why this hits. Older adults the hardest. According to Kaiser Family Foundation data, among Medicaid enrollees aged 50 to 64 who aren't on Medicare or disability programs, only 37% work full-time. 20% aren't working because of illness or disability. 9% are caregivers, and 17% are retired, can't find work, or aren't working for other reasons. Research published in the Journal of the American Medical Association found that about 1/3 of the 5 million adults at risk of losing Medicaid are between 50 and 64. And 2/3 of those older adults have 3 or more chronic conditions. 1 in 5 takes 5 or more prescription medications every day. When those medications stop, the consequences can be devastating. Uncontrolled blood pressure leads to strokes. Unmanaged diabetes leads to kidney failure. Missed heart medications lead to heart attacks. These are not hypothetical risks. These are the documented medical outcomes when people lose access to care. And remember, 45% of older Medicaid enrollees also receive SNAP. Losing one can trigger the loss of the other. States often use Medicaid enrollment to verify eligibility for food assistance, so this is not just about one benefit, it can become a cascade. All right, I've told you the problem. Now let me tell you what to do about it. There are 3 steps I want you to take, and I want you to take them this week, not next month, this week. Step 1, contact your state SNAP office and your state Medicaid office immediately. Do not wait for a letter. Do not wait for a phone call. Call them first. Ask them specifically, am I subject to the new work requirements? And if so, what documentation do I need to submit to prove I'm working or to prove I qualify for an exemption? The USDA has a state-by-state directory for SNAP offices at fns.usda.gov SNAP State Directory. I'll put the link in the description below. Every state's process is a little different, so you need to know what your state expects from you. Step 2, gather your documentation now. Don't wait until your recertification date. If you believe you qualify for an exemption, start collecting proof today. That might be a letter from your doctor stating you cannot work due to a physical or mental condition. It might be proof that you receive SSI or SSDI or Veterans Disability Benefits. If you're a caregiver for a child under 14 or an incapacitated person, get documentation of that. If you are working, even part-time or volunteer work, start saving your pay stubs, your timesheets, or a letter from your employer or volunteer organization confirming your hours. Remember, volunteer hours count. Training programs count. Hours can vary from week to week as long as you hit 80 in the month. And here's a critical tip from AARP. Bring more documentation than you think you need to your appointment. It is far better to have too much paperwork than to be sent home to get one more form. Step 3. If you receive any notice from your state, a letter, a text, an email, do not ignore it. Respond immediately. This is the mistake that cost Robert his benefits in the story I told you, and this is the mistake that caused 18,000 people to lose their Medicaid in Arkansas in 2018 when that state tested work requirements. According to Kaiser Family Foundation, 70% of the people in the Arkansas program who had to report their status lost their coverage. Not because they didn't qualify, because they didn't respond to the paperwork, they didn't understand the forms, or they didn't know they had a deadline. Under the Medicaid rules, if your state sends you a notice of non-compliance, you have exactly 30 days to respond and prove you're compliant or exempt. Your coverage continues during those 30 days. But once those 30 days pass without a response, you will be disenrolled. And you also have the right to a fair hearing, that's an administrative appeal, before your coverage can be permanently terminated. Use that right. If you have trouble understanding a notice, ask a family member to help you. Call your local area agency on aging, contact AARP, go to your state benefits office in person. Do not set that letter aside and forget about it. I want to be honest with you. This is one of the most significant changes to the benefits safety net for older Americans that I have covered on this channel. It affects your food, it affects your health insurance, and the compliance deadline for SNAP is March 1st, 2026, with benefit losses beginning as early as June. Medicaid requirements are coming within months for some states and by January 2027 for the rest. The people who will be okay are the people who know the rules and take action early. The people who are at risk are the people who assume nothing has changed, or who assume they're automatically protected, or who don't respond when the government reaches out. Please do not be in that second group. If you found this video helpful, please subscribe and hit the bell so you don't miss the next update. These rules are still evolving. States are making different decisions, new federal guidance is coming out, and I will be here covering every change as it happens. If you know someone between the ages of 55 and 64, a spouse, a parent, a sibling, a neighbor, a friend, please share this video with them today. They may not know these rules have changed, and by the time they get that letter in the mail, their clock may already be ticking. A free printable senior benefits protection guide with key phone numbers, websites, and deadlines is linked in the description below. Thank you for watching. I am Jocelyn, and I will see you in the next one.